for the culture. Hello, hello, hello. Good morning, viewers. Welcome to the Health and Wellness Hub. We are back again today on your screens. Today's another Saturday has been given unto us by a good Lord, and I hope everybody's doing well. Welcome to the Health and Wellness Hub. Today we are going to be talking about our dental hygiene. Dental hygiene. As usual, my name is Miss Dell, and I'm your usual host. And we're going to be having another special guest here who's going to be talking to us about our dental hygiene. Okay, so please share the link, tell your friends, your family, your loved ones that we are live, we are online. Please come listen to some good message, good advice. Come for free consultation with regards to your dental health. So stay tuned. We're going to start in a minute, please. I'll just give you a minute to just share the link, and then I'll come back and introduce our guest. Thank you. All right, welcome back once again. As I said earlier on, my name is Ms. Dum, your usual host here on the Health and Wellness Hub. Today, we're going to be talking about our dental hygiene. Okay, so before I introduce our special guest, guess what? Our sister Sarah is here. She's back with us. Welcome back, Sister Sarah.
Thank you.
We're glad to see you here. Yeah, she had to go take care of family business, and by God's grace, she is back. So we are going to go straight to hand it over to our sister Sarah to give us our nuggets, for the week. So please go ahead, Sister Sarah.
Thank you very much, Miss Dale. So, today our motivational message is knowing that we are unique. We all have heard several times the scripture says that we are fearfully and wonderfully made. But I want to add that we are truly unique in the way that God made us. Our voices are unique. The way we sing is unique. The way we laugh is unique. And our very presence is unique, and it's never going to be like anyone else's. And so recognizes that actually helps build your confidence and understanding that you are here for a specific purpose and reason. And the problems you are here to solve and the way you are here to, encourage others and be a source of, joy for people is just unique only to you. And so wherever you are and whoever you are not an accident. You were here purposely for such a time as this. The family you are in is not by accident. The place you're working at right now, whether you like it right now or not, is not by accident. And so you just want to accept that fact that you are unique in the way God made you, just like no thumbprint is the same ever or will ever be the same or match, even for twins. In the same way, you are unique. And so I'm encouraging you to embrace your uniqueness. You can't be like somebody else. And so don't try to be like somebody else. Be your authentic, true self, knowing that you are here specifically for the community in which you were born in, for the people with which you associate with. You are here to answer or solve a particular problem knowingly or unknowingly. And most of the time, we do not even know how we are being a source of encouragement and joy and delight to people until we are not there any longer. And so please embody and accept your uniqueness. Enjoy it. Share it with people. Don't hold back. If you need to talk, talk. If you need to sing, sing. And if you need to laugh, laugh. And be a blessing to the people around you. Thank you.
Thank you, thank you, thank you so much, Sister Sarah. We missed you. Thank you so much for letting us know that we are unique and God places us at special places for special reasons. Thank you so much. We're going to hold on to that for the week and every day remind ourselves that we are very special. All right. Thank you so much.
You are welcome.
All right, and viewers, welcome back once again. We just heard from our sister Sarah, who just gave us our motivational message for the week, and we're gonna have her right here back again next Saturday to give us more nuggets. Thank you, Sister Sarah. All right, so we are gonna go straight to our special guest for today. He's a special person, yes. Thank you so much for coming, Dr. Harry Ashite.
Thank you
This
for
is
having me.
Wellness Hub. Yeah. Okay, so Dr. Harry Ashite is a doctor of dental surgery, and is a comprehensive restorative and implant dentist, and is the founder of Aesthetic Dentistry and Implant Center in Corinth, Texas. With advanced training from the University of Ghana Dental School and New York University, he specializes in high-end smile transformations, including veneer, full mouth rehabilitation, and dental implants, featuring cutting-edge robotic assisted implant technology. Wow. He is committed to excellence, precision, and patient centered care. He is passionate about helping patients achieve confident, natural looking smiles. Wow, that's awesome. Thank you so much, Dr. Harry Ashite. So, we are going to go straight to what you have for us today about our dental hygiene. So, Doc, what is the most common dental problems that you see among Africans or, Ghanaian patients living, in the US?
Well, one of the major things that I come across is that we have this culture of delay. We do not go to the dentist because we don't see it as a need. So for me, that's one of the major problems. And what happens with the delay will be, resulting in cavities, tooth problems that could have been prevented in the first place. So delay is one of our major problems here in the US, especially for people of our background.
Wow. Well, most of us are guilty of that. So, how does diet, especially our traditional Ghanaian food, affect or prevent us from having a good dental hygiene?
Well, I mean, we our food is nutritious. It's great. What we are concerned about is the sweet, sugary, starchy foods. Those are the things that as dentists, we advise about, for patients, for clients, not to consistently be eating sugary foods, things that feed the cavity, liking bacteria, that will cause your teeth to start getting holes in them. And for us, our foods, for the most part, are great. We don't have major issues with them. It comes when we come to the US, that's when we start switching to sweet things, drinking soda nonstop and all of that. And that changes from, what we normally used to. And so here it's mainly frequency. The more you eat sugary, starchy foods, the more you run into trouble with dental issues. So
Yeah.
we can have it, but if you don't have anything to brush your teeth after meals, just rinse well, just clean your mouth well, and just prevent food from getting stuck on the teeth and going to bed with it. That's where we run into trouble.
Yeah, that's very true, Doc, because over here in America, almost everything contains sugar. So
Yes. Yes.
it's a
It's
challenge, especially with our kids as well. Yeah, trying to
Yeah, back home we used to drink Coke, during special occasions, right? But
exactly.
here in the US, we just have it anytime we want. It's
Yeah,
just easy, and that is
yeah,
a big problem. It's very acidic
it
to
is.
drink soda.
It is. So, Doc, let me ask, with our cultural background, as Africans and as Ghanaians, we usually don't like visiting, having a routine check, going for our routine checks. We wait till we have pain. We wait till we're not feeling well, or we're having a problem with our teeth before we go to see the dentist. What do you say about that?
Yes, so if we do that, we run into bigger trouble. One of the issues with dental problems or dental diseases is that they are very quiet. They quietly harm you. So when you start getting a cavity, it does not hurt at the beginning. And when you start getting gum disease, it doesn't hurt at the beginning. It's very slow. And by the time you realize, it's caused more problems that you would have hoped for. So by the time you call the dentist in pain, the damage has already been caused, and it's going to cost you even more to get treatment for that. And so it's advisable to be going more routinely to get these things looked at early because of the quiet nature of the damage that happens with these kinds of um, dental issues.
Yeah. So realistically, like, how often do we have to go visit the dentist?
Ideally, it's good to visit the dentist every 6 months, but it's in some unique cases for people with diabetes or gum diseases and things like that. They need to go a little bit more frequently. So instead of 6 months, we want to see them at least every 3 months or so that we can maintain the gum health, make sure that things are stable, and also to help with their diabetes, because especially people with diabetes, we have a very direct connection. I'm sure we're going to talk about that in this segment, but there are some things that we need to be careful about if you have systemic conditions.
Wow. So that brings to my next question. So, what is gum disease? That some of us
Well,
don't know.
well, very interesting. Well, so gum disease is an infection of the structures that support your teeth. So the teeth themselves are supported by gum tissue, bone, and some ligaments. Now, if we do not brush regularly, we end up running into trouble where the support structure of the teeth themselves start, failing. And so you have the gums receding or moving away from the teeth. You have the bone also getting weaker and weaker and losing bone. And then you end up having your ligaments also failing. And that's when you run into getting loose teeth and then eventually complete tooth loss. So, so gum disease as a problem that could start with, bad breath, um, you know, um, swelling with redness and pus coming out of the gums and things like that. So those are some of the things that we look out for when we say someone has gum disease.
Oh wow. Okay. Okay. So earlier on, you mentioned about diabetes. So what is the connection between oral health and some of the this let's say diseases that we have, like diabetes, pregnant people, pregnant women, going through other health conditions. Is there any relation to that?
Yes. Yes, the mouth is the gateway to the body, right? So if you don't take care of the mouth, you can have some systemic conditions, things that can affect the rest of the body. And one of the things that have been one of the strong connections is with gum disease and diabetes. They realized that people with gum disease tend to have difficulty in controlling their diabetes. So their A1C levels, the marker for how your diabetes is, the severity of your diabetes, gets worse with gum disease. And so when you start getting uncontrollable diabetes because you're not controlling your gum disease, then you run into trouble of other conditions that are not going to be solved because you're trying to solve your diabetes. Now you're worsening it by not going to the dentist, right? So we notice that people who have improved their gum health tend to have better A1C levels. And so those who have diabetes, if they go more frequently, we realize that their numbers are much better. Now, gum disease or any gum disease or anything to do with the mouth can also cause heart problems that can lead to even stroke and things like that because you're depositing some of the bacteria on the valves of the heart over time, and that could cause embolism and things like that will lead to a stroke down the road. So there's also been a very strong connection between, oral health and, um, cardiovascular health. And so we want to make sure that we take care of these things sooner than later. Preventative care is always important. The earlier we take care of it, the better.
Mhm.
And with pregnant women, it's also noted that people who do not have gum disease tend to have, or go frequently to see the dentist, tend to have better birth weights for their babies. And people with gum disease have, very, lightweight, kids, and gum disease in pregnant women can also occur
Mhm.
because of neglect, right? Because they're not cleaning their teeth, they are busy doing other things, and so then they start getting redness and bleeding and all of that in the mouth. Some hormonal changes during pregnancy can cause that as well. But when you're pregnant, that's when you need to be um, more deliberate to have dental checkups.
So, Doc, can that affect the baby as well?
Not directly, but the main thing I talked about is the weight, birth weight for right now. That's what we know. But of course, you don't want any bacteria in your body because once you have some bacteria in your mouth,
Mhm.
it can circulate in the blood and then goes up and down the whole body. So we will not know the exact, damaging effects that it could have on the babies. So
Mhm.
that's when you're carrying a fresh, very vulnerable baby. You want to make sure that you're maintaining your oral health as well, just so that nothing happens.
Wow, awesome, Doc.
Yeah,
we're
yeah,
we're learning here. So,
yes.
in that case, what are some good dental hygiene practices that we need to engage in? No, daily habits that we need to uh, look out for.
Yeah, it's almost very basic, but it's so important because little consistent effort will
Mhm.
go a long way to help you prevent gum disease and other dental health problems. Brushing 2 times a day is important. Brush in the morning, brush at night. Brush with fluoride toothpaste, and make sure to brush your tongue. Brushing without flossing is not really good because you can brush all you want, but if you're not getting in between your teeth, then
Mhm.
you end up, building up plaque and calculus in between the teeth
Mhm.
that, will be the main culprits for gum disease and also for cavity formation. So flossing as part of your daily routine is really important for you to get very complete, oral health care.
Mhm.
And we encourage that, every now and then you can use some types of mouth rinses. Zero alcohol, 0% alcohol mouth rinses are, good. Not so frequently, but every now and then try to use that as well.
Mhm.
So those are some of the things that you need to do. Baby steps, routine, regular. That's what we need. Yeah.
So, like, how often would you recommend? Like, is it once a day, twice a day, three
Twice
times?
a day. Twice a day. We want you to brush at least twice a day.
At least
Morning,
a minimum.
yes, at least twice a day. And then floss at least once a day. And
Okay.
also make sure that when you floss, I think ideally it's better to floss at night when you're going to bed because you want to be able to take care of all the foods that you've eaten during the day so that when you sleep, the bacteria that cause cavities don't feast on the food in the mouth in between your teeth.
Well said, Doc. So you talked about brushing. As typical Africans, Ghanaians, growing up back home, most people they didn't know about toothbrushes, chewing sticks and other forms of keeping the teeth clean. So what would you say about that? Like, are they also okay? Can we substitute those for brushing the teeth, or what do you say about that?
Yeah, good question. Good question. I mean, we do have our own traditional way of cleaning teeth, which I would say are great. You can use the chewing sponge.
Hmm.
Those,
Yeah.
it helps. Clean the mouth and take out all the you know bad breath and things like that. One of the things that I've noticed about our own culture is the use of the chewing stick. The
Hmm.
chewing stick is very hard for your teeth, and the teeth are dynamic, right? So they move, gently and here and there. So when you keep chewing on those hard chewing sticks, you end up causing your gums to recede sometimes. And most of the people who chew sticks, when I see them, they've had the gums move away from the teeth. And also, the same happens with the bone
Mm-hmm.
structure that surrounds the teeth. So, chewing something too hard, including chewing stick, and those who frequently chew on bone and things like that, puts too much pressure on the teeth, and that causes us to run into trouble with gum problems and tooth loss and looseness of your teeth. So it's good to keep some of the things we have. The chewing sponge is okay, but it's also important to use, professional cleaning materials like fluoride toothpaste, toothbrush, and things like that have been tested and proven to work well. Fluoride is important for your teeth, so something like that can help reduce cavities and fortify your teeth and all of that. So we encourage that as well. So we don't say do not use what we have traditionally, but at the same time we want you to kind of not make them exclusive. Just use them together.
Okay. All right then. Okay, viewers, please, if you have any questions or any comments, please put them in the comment section, and Doc will be happy to answer your questions, please, regarding anything in regards to your dental health or hygiene. Thank you. Okay, so Doc, earlier on we talked about I made mention of challenges we face as parents. How can we encourage our children to maintain good oral hygiene? It's a big challenge.
Yeah, good question. But we have to be the example. So that's the solution. So if we are the example, we are brushing routinely, and the children are watching us do that, and we're just constantly brushing, flossing, and talking about, how it's important to have good breath and things like that. The children learn that from you, and then they emulate that. So that's very important. Now, that's the first step. When they see, they do. But if they don't see the parents doing it, sometimes it's just, non-existent for them, and they try to, not want to do it. Now, we encourage our children to brush twice a day, but especially between the ages of about 6 months to maybe 10 years, there's something called anticipatory guidance. You want to be guiding your children to brush their teeth, checking them. Hey, can I see your teeth? You just brushed them. Let's see how you did. Great. Encouraging them. Your teeth look great. Your teeth look white. And then you kind of keep that motivation going for them to feel that, okay, at least they're making some progress. And they know that mommy is watching or dad is checking. You don't yell at them. If you yell at people, you yell at the children. Culturally, we want to yell, right? And so
Yes.
once we keep doing that, then they become defensive, and then they don't want to do it. And then it becomes a problem. So let's do everything with some type of tact and some type of love with it, boosting their ego a little bit and then getting them to do it.
Okay.
Yeah.
So Doc, that's another question. So let's say how long should you take to brush your teeth? Is that a set time, like 2 minutes, 5 minutes?
Well, there's no set time per se, but generally people have come up with a number saying 2 minutes. So 2 minutes is a good time, but you can be 2 minutes and be brushing just the front of your teeth. That doesn't make anything. Now, if you're brushing, you have to take your time to brush in gentle circular motion, not with a hard toothbrush. That is so hard that it's ripping away your gums, right? You want to brush with medium texture type of toothbrush where you're brushing very gently in very circular movements with the angle of the toothbrush about 45 degrees towards the gum line, and then brushing carefully and gently. Brush the outside of the teeth, brush the back side of the teeth, and brush the biting surfaces of the teeth. So you brush the inside. A lot of people brush the outside of the teeth and forget to brush the inside of the teeth. So that is something that I've noticed, and I encourage that, when we do that, you don't just think about time, but you think about the technique and how you're, cleaning as well.
Wow. Thank you so much, Doc. So with all these that you've said, there's one challenge, and there's another challenge, especially those of us here in the US, insurance. If you do not have dental insurance, I'm sorry, if you don't have insurance, there's no way you can go see the dentist. So, what are some other ways, that we can go about, practicing or having a good oral hygiene if we don't have insurance, or if there are other ways that, if you know of other ways that people can go seek for, cheaper or even have free dental insurance or dental care.
All right. I would say that dentistry or dental care here in the US tends to be very expensive here and in Canada and in other places, of course, in the UK and all other places like that. It tends to be a little bit more expensive. And so that becomes one of the deterrents for people to go to the dentist. But I would say that taking good care at home is the first step. Brushing regularly, stay on top of things, not missing, flossing with routine, home care will kind of help, take away from the disease formation in the first place. Right. But we do not want to completely avoid using professional proven methods to be able to check and see with x-rays and things like that, things that are just starting at the early phases. Because if we do not go, a small lesion that could have been stopped earlier on will now grow into something that's irreversible and more expensive to handle. So people are worried about cost. But sometimes if you talk to some dental offices, they have internal plans, discount plans that they can offer you. It's always good to ask. There's no harm in asking. Culturally, we're afraid to ask. But here now, we've come to learn that we need to be bold. We've got to ask for things and say, okay, what other options do you have? How can I afford this? And then some offices will come up with solutions for you that will fit your budget. So that's the first place, right? At least get some checkup so you know where you stand. This way you can plan on how you can tackle it. But if you don't go at all, it becomes even more expensive. And so it's good to start with, basic cleaning, sometimes not expensive, sometimes it's reasonable and it's mostly affordable. Basic exam, basic cleaning, not too expensive. But if you wait, then you're going to get advanced cleaning, deep cleaning, that's very expensive.
Yeah.
So it's important. Some schools are there that can help you. Some dental schools can help you afford dental care. So you can call some of the dental schools. Some community centers are there within your local counties. You can call them as well to see if they're offering free dental care. Some dental hygiene schools. You can call some dental hygiene schools. They want people to use for their training. And of course, there'll be a professor over there who will be looking over their shoulder to make sure that they're doing the right thing. So you get the care, and at least they take x-rays. And at that time, if there's an issue, you'll be able to know that as well. Wow. But check with your local dentist, check with your local community, and I'm sure you'll be able to find some care that you need.
Wow. Thank you so much for that, Doc.
Absolutely.
Okay, so let me see if we have some questions from our viewers. Okay, Ethel Covey says yes. Yana 2020 says yes. Ethel, thank you for watching us. And then Phantom from Flex says it's called Kaka. I guess maybe it's the gum disease that.
Yeah.
Yeah, he's referring to. Yeah. Okay. So basically, those are the only questions that we have from our viewers for now. We also have our DJ Mawanyega, who hosts the African jazz music section here on the same channel on Friday evenings. He's here also joining us in the studios. Welcome, Mr. Lawrence Mawanyega. You're muted.
Thank you very much, Ms. Dell. And thank you so much, Dr. Harry Ashitate, for taking the time to be a part of this program. We really appreciate the time you've given us this morning to educate us on our dental hygiene and all that. At my age now, I'm dealing with most of my little grandkids, and I wanted to find out from you at what age should a child be, have their first dental appointment, and how can parents prepare them to prevent dental phobia? Most of these kids sometimes they're so scared, and what age do you think is best for them to see the dentist for the first time?
That's in most cases here in the US, you'll be amazed that they want you to start seeing the dentist as soon as you get your first teeth. That's around about 6 months old.
Okay.
So your first two teeth, that's when you start going, and then you start seeing the doctor. Start seeing the things around the dental office and things like that. So we see you every 6 months. I mean, at the age of 6 months, and see you sometimes even every 3 months until you are 3 years old. In some cases,
Okay.
okay. Routinely coming in, getting some fluoride put on your teeth, doing some prophylactic cleaning, getting used to the tell, the show, and the doing. We tell them what we're doing, we show them what we are doing, and then we do it. This way, they are not afraid and they are aware of the dental environment. So, as early as 6 months, you'll be
Mm.
amazed.
Okay.
Yeah.
That's good to know because my grandkids have not been to the dentist yet, so we need to work on that,
You need to
yeah.
start working on that. Yeah.
I know. I wanted to ask you another question about grinding my teeth. Well, I thought I was a quiet sleeper. I don't think I grind my teeth, but last visit I had with my dentist, they said, well, look like you're grinding your teeth at night, and so they decided to do a guard or something for me. How can you tell, if you're grinding your teeth, and what do you need to do?
Oh, that's great. I mean, teeth grinding is not normally something that is always heard loud when you're sleeping. It's a
Okay.
very subtle, gentle rubbing of the teeth together while you sleep over time. And that could be caused by various things. It could be stress factors. It could be different things that happen during the day that make you clench and grind. And over time, you have what we call attrition of the teeth, meaning that the tooth structure itself is changing from what it used to be when you had no issues with them. You will see that we have some areas where we show wear facets, meaning that we can see areas where there's some troughing on the teeth, and that is classical of teeth grinding. The teeth don't just wear out on their own. It only happens when you do that abrasive action on the teeth, and this is subconscious. It happens. Sometimes my patients will say, "I don't grind my teeth at all," but the clinical evidence is there,
That's
and
what
I
I was
see
telling
it
you.
very. I see it's already. So it's very amazing when they look at us and say, "I'm not grinding my teeth at all." And then I sit back and I'm like, "Wow!" But this this is classical of teeth
Yeah.
grinding. And when we do the night guard, it's important because then it prevents your teeth from getting worse. And if you do not do anything, it's only going to get worse from there.
Okay.
When you lose a tooth structure, you cannot grow back the tooth that is gone,
Mm.
but you can prevent it and make it stable from getting worse. Yeah.
Okay.
Yeah.
Now, another question I have is, what are some of the primary causes for tooth sensitivity, and what kind of treatments are most effective for long-term relief? I sometimes you have this sensitivity that we cold, drinks or whatever, and it goes on, but there's nothing wrong with the tooth. What can you tell us what the causes are, and how to prevent that?
Yeah. So one of the classical signs of something as simple as tooth grinding is the loss of gum tissue around the tooth. So while you're grinding, the gums move away, they recede. And we see that there are some areas of what we call abfraction of the tooth where you're losing some tooth structure as well. And over time, you get to the point where some parts of your roots are showing. Your roots are meant to be covered by gum tissue. The roots does not have enamel on it. And so that part of the tooth is very sensitive. So when you start getting sensitivity, it's mainly due to some parts of the root structure that is becoming sensitive, or sometimes you even wear out the entire enamel over the tooth, and now you're inside the inner portion of the tooth called the dentin, and that part is very sensitive as well. So those factors can culminate into those sensitive tooth syndromes. But there are some instances where you've had a filling in the past, and the filling is defective or is failing over time. Then you start getting sensitivity. So when you start getting sensitivity, it's always important to at least have it checked. If the tooth is stable and normal, wearing a night guard can prevent it from getting worse. And if you have a cavity that needs to be refixed, then the doctor can take care of it then.
Okay. All right. I know you guys have new technology or dental technology these days, and the laser screenings to improve early detections and so forth. and those are quite expensive. Some when you go there to visit our doctors. But how do these new technology compare with traditional, methods?
Yeah, yeah, that's a good point. I mean, they're just aids. We call them the aids. We still
Okay.
have our traditional ways of taking X-rays and visualizing it with our clinically trained eyes to see what's
Mhm.
going on and all of that. But these days we have AI and other things that have been incorporated into it. So sometimes, as clever as a dentist could be, we might miss something sometimes.
Mhm.
And the AI will kind of hint you on, can you double check on that? Can you
Mhm.
double check this? And this way you are treating the patient more comprehensively without trying to miss anything. And this is happening across board, not just in dentistry, but in medicine as well.
Mhm.
So it's a good thing. We're embracing it. We're adding it to what we have. Um, they will not completely replace us, but they're also part of the process, right? So
So,
we
yeah.
need to use all of it. Yeah,
Mm. Okay.
yeah,
Very well. You address the chewing stick situation. I thought that back home, we were doing a lot of damage to our gums, but
yes,
people,
yes.
people do
I
that.
mean, it
Mm.
makes your teeth loose over time.
Right.
And, one of the problems with our Ghanaian group is that sometimes we want to just take out the tooth when there's a problem.
Mm-hmm.
Just
Yeah.
take it out for me and I'll be free. But
Mhm.
the problem with that is that we don't get a balance of your bite. Now,
Yeah.
once you miss one tooth, the other teeth want to move into the space where the tooth was removed. And
Mm-hmm.
so you have your teeth moving around, and by the time you realize teeth are crooked, your biting is off, and then you run into multiple other dental problems.
Mm-hmm.
And so we encourage that as much as possible, we keep the teeth we have. But if you end up losing a tooth, talk to your dentist about how to replace them.
Mm.
Okay.
This way
Okay.
you have a balanced bite, balanced
Mm-hmm.
occlusion. And
Mm-hmm.
this way everything is in harmony and you can keep your teeth. We do not grow old to lose teeth because in our culture we're told that you grow old and then you lose
Right.
your teeth is
Lose your teeth.
normal. That is not true. I just came to, because I'm in the field, I get to understand that you can keep your teeth until very well into your hundreds. You
Mm.
don't
Wow.
need to lose your teeth
Okay.
because you maintain your teeth, you go routinely, you're getting your teeth checked, you can keep your teeth a lifetime. Back
Mm.
home, there's no care. Nobody
Right.
goes to the dentist. It's not part of our culture to be going to the dentist every 6 months.
Mm.
So by the time you realize the problem has been caused slowly and the damage has already been done and it's
Right.
irreversible. Yeah.
Wow, that's interesting. And Doc, what about when you grow to a certain point, you have the wisdom teeth, and then sometimes it has to be taken out. Like,
Yes.
how true is that? Like, does
Yeah.
it have to be taken out?
Yes, that's a good question. Here in America, we take our wisdom teeth a lot more frequently than in most other places. One of the reasons why wisdom teeth are taken out is sometimes when they are coming into the mouth, they come in at a certain angle that is not right. It looks like you have a small jaw and big teeth. And so the teeth fit in, and then the last tooth coming in doesn't have room to come in. So
Mhm.
it tends to come in at a certain angle. And when that happens, we are running into a situation where food is getting trapped in between the good tooth ahead of it and the wisdom tooth. Over time, you're going to get a cavity on the wisdom tooth and as well as the tooth ahead of it. So we take the wisdom tooth out to create room for you to be able to clean around the teeth that you have so you can maintain them. We don't normally chew with the wisdom teeth anyway. So we would rather you don't have it as a preventative measure to take that out and then prevent you from getting other tooth problems.
Mm.
So
Wow,
that's
interesting.
more, it's more prophylactic type of way of managing things, and also prevent some types of cysts from forming sometimes. So early detection, early removal, peace of mind.
Interesting.
Yeah.
I never allowed mine to be taken out, so maybe I have to. Now I
It
have.
depends. It depends. If your teeth come in well and they are all in properly, you don't need it to
Yeah.
remove.
I
Okay.
know.
Yeah, you don't need
I
it to
still have
remove.
mine. All my four. And
Oh,
every time
good.
I go to
That's
the
good.
dentist,
Yeah.
they look at it
Yeah.
and say, "Look, if it's not bothering you, don't
Uh,
bother. Don't do anything with it." Yeah.
Yes, yes. Sometimes gum tissue grow over it, and the gums get red and they get inflamed because you're not able
Mhm.
to clean well.
Yeah.
We want to take that out so you don't run into bigger jaw
okay.
problems. Yeah.
Yeah,
Okay.
because I sometimes I experience that.
Yeah.
become swelling, and then it will go back, and then
Yes.
so now I need to. I have no option.
Yes. Yes. Have a good dentist look at it for you.
Okay,
Mhm.
all right, interesting.
Yeah.
Now, when it comes to diet, though, are there any specific dietary, considerations to strengthen our, enamels and all that, or even reduce the risk of cavities and gum disease? Are there some dietary things we need to that will help? As mostly.
Yeah. Yeah, I mean, I don't know. I think, of course, you can, especially in children, we encourage them to drink things that help with teeth health, like vitamin D and things like
Mhm.
that.
Right.
Multivitamins.
Mhm.
Most of our foods from Ghana are healthy, nutritious foods. So those are good. We're eating these greens and carrots and all the healthy foods. Those are important. Fish, all the things that with milk we want to eat those things as
Mhm.
normal, just normal eating. But the problem is that when we start getting into American way of eating, where we start drinking juice after every meal or drinking soda after every meal as if it's part of eating, then we run into frequency issue. The more frequent you drink these sugary, starchy, sticky foods, that is when you start running into the trouble of having your teeth getting dissolved with acidity and things like that. And so we want to reduce frequency, and the stickiness of the food also over time just stays on the teeth and then just allows bacteria to have a field day to now convert those sugars into acid. Because bacteria, when they feast on the sugars, they turn the
Mhm.
sugar into acid. And the acid then goes over the teeth and just dissolves it. And that's when you have a black hole in the tooth. And then it
Mhm.
starts very quietly. You don't feel any pain. It keeps burrowing into the tooth and keeps going. And then it hits your nerve. And that's when you have pain. By that time, it's too late. That's when you need a root canal
Right.
treatment. And
Mhm.
with that, you will need a crown. And with that comes with a lot of money. So save the dollars, use the coins to get the teeth cleaned and maintained and
Mhm.
prevented from getting bigger issues.
Mhm.
Otherwise, you're going to use stacks of dollars to treat them.
Okay.
Go on, Doc.
Now, let me ask you this. In your opinion, though, what type of toothbrushing, electric or manual? I mean, which one do you prefer, and the type of toothpaste also, would you recommend? Because there's so many brands and different things. There are manual toothbrushes and electric toothbrushes. What do you recommend,
Yeah,
personally?
yeah. There's electric toothbrushing has been found to be very effective. To be honest, we have seen that electric toothbrushes will do a lot more movements over the teeth
Hmm.
than you manually going over the teeth. And sometimes with manual, we end up missing some parts of the teeth.
Hmm.
With electric toothbrush, gentle holding over the teeth and moving it around slowly for it to do its own work. You
Hmm.
keep going back and forth in a very gentle, smooth. You don't hold the electric toothbrush and move it around with force
Right.
because it doesn't do anything. You
Mm.
want to gently hold it over the tooth to work. It's good. There are a plethora of electric toothbrushes around. Try to get ones that are slightly expensive. Some ones that are a little bit above $50 or $60,
Well,
and
that's, yeah.
then at least those ones are a little bit more advanced with the technology, and that
Hmm.
would help you keep your teeth clean.
Sure.
But if
Sure.
you are very good with your manual dexterity, it's also
Hmm.
there's no problem using just manual toothbrush.
Okay.
Wow.
Yeah.
Wow.
Very well.
Well, thank you so much.
Mhm.
It's been an
Absolutely.
interesting session and a very
Blessings.
educating one. Yes.
Mhm.
Yes, I've enjoyed it myself. It's nice to connect with the community, and I'm happy to be a part of it.
Thank you.
Absolutely.
I've learned a lot and things that I need
Mhm.
to go take care of. So
Excellent.
thank you
All
for
right.
letting us know and thank you for spending time with us. Even though you are at work, he's at work and he willingly came on to
Wow. Thank you.
educate
Thank you.
us.
Yeah,
Thank
we
you so much.
appreciate you.
We really
My
Yes.
pleasure.
appreciate you, Doc. Yeah.
Thank you so
We
much.
appreciate you so much. So
All right.
thank you. It's been another great session here on the Health and Wellness Hub. We've had Dr. Ashite, Dr. Harry Ashite, talk to us about our dental, hygiene, how to take care of it and maintain good health. Thank you so much, Doc. We're really grateful once again
Thank
for
you.
that. Yes.
Bye-bye.
Okay. Bye. Thank you, Doc. Okay, so before we wrap up, let's go over the programs that we have here on Sienna Media on our YouTube and Facebook channel. On Friday evenings, we have DJ Mawenyega, who just came on the show, who just joined us. He hosts the African Jazz and Traditional Music Panorama here every Friday. Is 8 p.m. Eastern Standard Time or 7 p.m. Central Standard Time. So if you need some good music for your Friday relaxation, just tune in and listen to some very good African jazz music. I always enjoy it for my Friday relaxation. Yes. And then after that, so that's for Friday. And then Saturday morning, the Health and Wellness Hub is here with you. We come here with our various health topics. We have professionals who join us in the healthcare or other aspects who come here and talk to us and educate us on our health and our well-being. So that comes on every Saturday morning, 9:30 Central Standard Time or 10:30 a.m. Eastern Standard Time. And then after that comes for Steve and Empress Mausi with the Sienna Central Talk Show, 11 a.m. Eastern Standard Time, right here on the Sienna Media TV here on YouTube and Facebook. And then after that, we have Miss Robert. Miss Robert. No, I think no, Dunino Boboa comes before Miss Robert. So all the way from Ghana, Mama MFA joins us in collaboration with Top Radio. And then they also have various discussions as we enjoy some Bobobo music here. Yeah. And then after that, there is the Mr. Obegbe. We have Dr. Cyrus and Dr. Dogbe, Dr. Wonyo, and their entourage also come to teach us our Ebe language, So we can join with your friends, with your family, with our children, especially the children that we've given birth to abroad need to learn our language. So there's a good place and a good way to help them learn our Ever language. So that's it for Saturday. And then on Sunday, our sister Nicole comes our way with a fricature. She also comes up with various guests who will talk about our culture and our faith. So basically, those are the shows that run here on the Sienna Media TV on YouTube and Facebook. Please, please, please continue to share, like our channel, and spread the gospel. Share to your family, your friends, and loved ones, and please subscribe to our channel. So whenever we are online, you'll be notified so you can join us as we learn and grow together. Thank you all so much. It's been another wonderful show here on the Health and Wellness Hub. Very interesting. I personally have learned a lot. I keep learning a lot of this show because we bring here professionals who know and who are experienced, in their professions, especially in the healthcare. So thank you all for joining us. Until we come again your way next Saturday morning, stay strong, be healthy, and remember your health is your wealth. We love you all. See you. Bye-bye.
That was good.